Hello, everybody. Today, I wanted to kick off the first episode in a new series that I'm going to call the Neuro-Chemistry series. And in this series, we're basically going to be talking about all things related to blood work and how we analyze blood work and how do we use a functional medicine approach utilizing supplements and nutrition and dietary factors and lifestyle changes and all these various things in order to assess these various blood markers. And I thought, what a better way to start this series by talking about why number one, it's important to assess blood work when it comes to individuals who are presenting with some sort of neurological symptom, because that's the kind of patients I see, but overall, just general well-being and general health. So my name is Dr. Matthew Shim. I am the owner of Peak Brain Performance Centers here in Colorado Springs. And the first thing I wanted to talk about is just a basic little example that I give most of my patients when they present to me. Let's say they come in for an initial exam, and then we have to decide what the next step of action is. What's our plan of attack? How do we want to handle these symptoms that you're presenting with? Do we want to go down the route of rehab? Do we want to go down the route of more blood work and metabolic nutritional lifestyle changes, or do we want to completely refer out to a different provider? So let's just assume we're going to keep this in-house for whatever condition it is that you're presenting with. And now the question is, do we want to go down the route of more metabolic work and nutritional and supplementary stuff, or do we want to go down the rehab route? And so the example that I give people is, let's say that your house is on fire. And what you could do is you can go buy some new furniture and new, decorations and stuff like that, and you can put it in your house, but eventually all that new stuff is just going to burn up again, right? And so the more logical thing to do would be to have the fire put out first and then go and do the remodeling and the redecorating after. And so that's kind of how I like to approach my rehab or my plan of attack when it comes to patient care, particularly whenever I have patients present with things that make a light bulb go off in my head that make me think that there's a more metabolic route. Now, there are often times when people come in just after hitting their head and there's not really a whole lot of metabolic work that needs to be done, or even any, and so we'll go straight into the route of rehab. However, there are cases that, whether it be, the presentation, the symptoms that they're having, the mechanism of injury, past history, past family history, these are all things that might light up in my own head to make me say, I think we should probably look at blood work first. And so now the question becomes is, whenever you do labs, there's always a reference range next to the individual marker of the lab that you're running. And so the question is, how are those lab ranges actually established, and how do I know that that range is actually what's acceptable for me? So this excerpt here comes from a book called Diagnostic Hematology, and they wrote that all laboratory testing procedures are really estimations. Regardless of how carefully the tests are done and of the degree of sophistication of the equipment and personnel, the user should be aware of inherent limits that the laboratory operates within. No matter how good or even certified or accredited it is, and should also know how clinically acceptability varies with different tests. The clinician cannot abdicate his responsibility in this regard and has therefore an obligation with regards to taking and submissions of specimens and then deciding how to approach the results once received for his clinical purposes. It is as well to reemphasize the common preconception that not only are laboratory results wholly writ, but they are 100% reliable at all times is a fallacy. And so basically, when we run labs, they're a snapshot in time, right? And with that, it's now the responsibility of the provider to know what to do with it and to be able to establish these different diagnoses based on the different lab markers. And so I think that this little excerpt, what they're trying to say is that, to put into layman's terms, is basically that you can't, for one, rely on one single marker to make any accurate diagnosis. And you have to combine a number of different tests in order to come to the most accurate diagnosis, which then leads to the most accurate treatment. And so the second question is, once you look at your lab panel, you ran this panel, there's these various markers on the left side, and then there's the reference ranges over there on the right side. And the question is, how do they come up with those reference ranges? And so from the same book, they wrote, these and other logical problems have caused the word normal to replaced by reference. And so like we talked about before, there's a reference range on the side. These ranges are fairly arbitrarily defined in terms of the standard deviation and or the coefficient of variation, and mean that certain results near the units are excluded, possibly unfairly. The idea being to exclude any subclinically abnormal results, which in fact may not be present. And so basically, let's say that you go into the lab. You go into the lab and you get some blood work done at the lab that's nearest to your house. And then I go and get the same panel done at the lab that's right here next to my office. How do they come up with the reference range to classify what's normal for you and what's normal for me? How they do it is they come up with different ranges in regards to if you go to that lab and I go to this lab. Now they take an average of all the people that presented to that particular lab. So let's say you went to the lab by your house, I went to the lab by my office. And so what happens now is the lab that I went to, they're going to take all the people that have presented to that lab, take an average of all those people and all of the people who ran the particular panel that I ran, as well as and they're going to classify the average as normal. So they basically chop off the top and bottom like 10 or 20% and then classify the middle as normal. Same thing with the lab that you went to. Now that lab, they take all the people that presented to that lab, take an average of all those people, chop off the top and bottom, top 10 and 20%, and then they classify the middle as normal. And so the problem with that is that, for one, who are the people that typically present to labs? Most of the time, I think that people that are relatively healthy and feeling fine, they're not usually going and doing, preventative lab work. Most people that are presenting to the lab are going there for a reason because they're dealing with some sort of symptom, right? And so they're going to find out what's going on and try to get answers on what to do next, right? And so the problem here is that now you're getting an average of all these unhealthy people. And then on top of that, when you're only chopping off, let's say the top and bottom 10, 20%, there's still a large range of people in the middle. And so this is where lab ranges versus functional ranges in it, okay? So if you go to your typical primary, this is what most people that present to my office will tell me in regards to labs and even imaging studies and stuff like that, is you'll go and you'll get these various tests ran. And then what happens is you come to my office and you say, well, all of my labs were normal, all of my imaging was normal, all these other things, all the testing that I've done, I was told is normal. And the problem is that you don't feel normal. And so it can be frustrating for you as a patient because you're no closer to finding the answer to what's going on, right? And so for people such as myself that practice functional medicine, we do a little bit more digging into the research and in regards to what, if let's say we take a hemoglobin marker or a hematocrit marker or a white blood cell marker or a red blood cell marker or anything like that, we now have to dig into the research and say what, based on prior studies, is deemed normal or optimal for these various markers. And then on top of that, based on my own prior experience or other practitioners' prior experience, what do they all think that is this marker should be considered normal? And so oftentimes the lab ranges and functional ranges being stuff that we as functional medicine providers will utilize, and lab ranges being what your typical primary medical doctor will use. Their functional ranges are typically a lot narrower. And we're basically looking for, instead of just looking for things that are outside of the pathological range before we can make a marker or make a diagnosis, we're going to look at patterns in the fact that, for example, if you look at somebody who is iron deficient, you could look at a marker called serum iron. The problem with serum iron is that serum iron really only measures 1% of total body iron. And so with that, it's not really a good marker if you're looking at trying to assess something and you're only getting 1% of the total marker, right? And so with that, we like to use another marker called ferritin, which is the storage form of iron. And with that, ferritin measures about 22% of total body iron. So still not great, but it's the best that we have. And then on top of that, ferritin can also increase ferritin will increase if you have more iron and decrease if you have less iron or iron deficient, but it also increases whenever you're inflamed. And so again, you may see an individual who has a really high ferritin number and you would think that, oh man, they must have a lot of iron. But realistically, they could be chronically inflamed. And so with that, You now have to look at other markers such as a CRP or various things like that, or an albumin, and look at these other markers to kind of localize the area of problem a little bit better. And so with that, I hope it kind of explains to you and describes how lab work by itself is pretty important, and finding a provider that knows how to accurately analyze and then make the appropriate treatment after is really important in regards to finding a provider, not only for rehab, but now that we see also in regards to looking at your labs. I hope you enjoyed that. If you have any questions, feel free to email me or give my office a call, and then follow me on Instagram and Facebook. Other than that, I will see you on the next one.